So many questions about root canals. Does it hurt? Most of the time it doesn't hurt. When patients come in, they often have like a little bit of tenderness around the area, or they notice pain to biting, keeping them up, pain that keeps them up at night, not really any major swelling. And that's the best case for us to be able to treat a patient when they present with symptoms like that. The numbing medicine works so well, you are not knowing you're getting a root canal versus getting a filling done. I've had patients that say, oh, I've heard about root canals and I'd rather give birth than have a root canal. It's not like that anymore. Like I said, our numbing medicine works so well that you'll be just as comfortable as getting a filling done, and it's a pretty straightforward procedure. You will still have your root when the root canal is done. A lot of people think like, well, I had a root canal, my root is gone. No, it's not gone. It's just the center of the root where the nerves and blood vessels are in. We take that out and clean it out and fill it with a little material down in there, but your root is still there. And then the crown goes on after. The crown is very important to have on the tooth after you've invested in a root canal, because the tooth gets real brittle once the nerves and blood vessels are out. The crown is on there to help protect the tooth. Is it better to do a root canal or have your tooth pulled? You always want to try and save your tooth. The best implant is your own natural tooth. If there's not enough tooth left above the root, then we need to pull it and we would do an implant. But definitely if there's enough tooth above the root and you can save your tooth, that's the best thing you can do.